A new voice for Canadian nurses. The federal health minister announcing Leigh Chapman as Canada's new chief nursing officer.
With this growing crisis, we need to support our nurses, make sure they are heard, and that their challenges are met with solutions.
A registered nurse with a background in intensive and emergency care, Chapman's been in the field for nearly 20 years.
I'm really hoping to be able to advance this work in a meaningful way.
Canada had chief nursing officers beginning in 1968. The position was eliminated in 2012. As Canada's nurses face overwork and burnout, some started calling for a return of the advocate role.
I really do hope that nurses who are in the profession find resources to stay, and I hope that we can make the workplace amenable to that as well, because we absolutely need all hands on deck.
Her job now? To offer advice on federal and provincial health strategy, especially aimed at growing the workforce.
I certainly hope that having someone to really advocate and voice for the nursing profession will open up more doors.
But some watching the announcement were expecting more from the federal government.
When I saw it was at a university forum, I thought, oh, good. We're going to see some support for our new grads because they need support, mentoring support when they go into the workplace, because the workplaces are atrocious right now.
But she says all help is welcome.
What's key is the bureaucratic level needs to be connecting with real working nurses.
Making those connections will be no easy feat. With frontline nurses pushed to the brink and the federal and provincial governments sparring over health transfer payments, Chapman will have her work cut out for her. Paige Parsons, CBC News, Ottawa.
So the last words of that story, she has her work cut out for her. You sure do, Leigh Chapman. And given all that's happening in concrete terms, where on earth do you begin?
Well, I think the first thing is to really meet with the provinces and territories and work with the nursing stakeholders to explore the issues in a very fulsome way. I think the key priorities have to do with health human resources. So specifically the nursing shortage. So when we think of supply of nurses, we know we don't have enough nurses currently, but we also know we need to work on not only just recruitment of nurses, but retention issues as well. So we need to be able to retain those who are currently in the workplace and improve the conditions for them to be able to stay. Another key priority is internationally educated nurses. We know there's a number of internationally educated nurses here who have a very cumbersome, often a very cumbersome and difficult pathway towards registration and licensure.
Let's talk about retention, though. What would make it easier for a nurse showing up on shift?
I think the things that would help would be to know that you are adequately resourced when you come in to work a particular shift. So that means having the right number of folks there, but also having the supplies that are required to do the job. I think also nurses need to be able to look after themselves. So that means leaving work on time, ensuring that there is somebody coming in to relieve them. I know there's a great deal of moral distress when nurses are working short and also unable to leave and unable to know really when they're going to go home. And that really is an untenable situation.
You know, you said something interesting today in the news conference. You said that one of your jobs will be to amplify the voices of nurses. What is not being heard?
Well, we haven't had a voice for nurses at the federal level for over 10 years. And so I think it's very timely that this role has been reintroduced and reinstated at such a critical time. So I really hope to bring that perspective forward with colleagues, really with the nursing community.
Well, not only that, the whole country's counting on you, but no pressure at all. Thank you very, very much. We all wish you the best.
Thank you very much for having me.